Hello, everyone. Hi, this is Dr. Ergin. Good morning, everyone. So I don't know how many people are on right now, but we are live right now, and I'm open to your questions. So you can ask your questions at the chat button right here at the right lower corner, and I'll try to answer your questions as much as I can. I see Robert said hello. Hello, Robert. Do you have any questions, Robert? Okay, so let's see. Okay, again, SugarMD is open to questions right now. We are live. WSLM Radio said good morning. Good morning. Sunday is a little bit early for you guys, huh? All right, so today we are going to talk about diabetes. There is no specific topic to talk about. If you have any questions about the diabetes itself, the blood sugar management, it could be medications that you're on, if you're having any side effects, if you're happy with a medication that you want to hear more about, we can talk all about that today. So, somebody said that WSLM Radio, I was hospitalized last December with sepsis and have my appendix removed. I was diagnosed with type 2 diabetes. I was 319 pounds. Okay, you wanna, I wish we can have a one-to-one conversation, but I will have you write your experience with your type 2 diabetes. So you are at 319 pounds. Of course, that's definitely a risk factor that will put you for possible diabetes. Now, not that every overweight individual will have diabetes, because that's also mostly genetic. So 60% of diabetes is due to genetic factors and 40% environmental. But having said that, if you are able to lose some weight, the genetics, the potential you have, will still be able to maintain your blood sugars. So I hope that's what you're doing right now. Okay, so Lena Asher said, hi, Doc. I'm an Indian vegetarian. My main problem is rice and bread. Can I consume 2 pieces of bread at a meal or 1 cup of rice? My mother is diabetic. So good question. So I think what I typically recommend to diabetics is like your carbohydrate needs are based on you, not someone else. So there may be another diabetic who can eat 5 slices of bread and 2 cups of rice, and they will still be okay just because their diabetes is different than your diabetes. So if you are active and if you are taking medications, it is okay to have carbohydrates that are up to, depending on your age again, but I would say if you're a middle-aged person, I wouldn't exceed more than 60 grams for men and more than 45 for women. And these are generous, but if you're active, you can go a little bit above. But if you're not active, if you're mostly home, I would definitely suggest that you stick to your 30 grams. Now, 2 slices of bread is around 30 grams. 1 cup of rice can be up to 45 grams. So that's like a 3 serving. So again, what I would suggest if you're eating bread, depends on like what bread you're eating, makes a big difference. So my favorite breads are pumpernickel bread, for example, or multigrain whole wheat versus the white bread. Definitely will make a huge difference. When it comes to rice, you can use brown rice. It still spikes your blood sugar, but a couple alternatives to rice could be farro, F-E-R-R-O. That's a good multigrain. There's also cracked wheat that you can try, which is sometimes some people call bulgur, like B-U-L-G-U-R. These are good carbohydrates that they do not really spike your blood sugar as fast as rice or potato or bread would. So I would suggest trying those as well. And the bottom line is check your blood sugar after you eat. And if your blood sugar is spiking after you eat, like about 180, 1 to 2 hours after a meal, that means that you will have to adjust certain things. It could be your diet, could be your exercise, could be your medications, but you will definitely need to adjust this if your blood sugar is spiking more than 180. So 180 is a number that we do not want to go above because that becomes really toxic at that level, the blood sugar levels. So WSLM radio said it really scared the hell out of me, and I began to eat strict low carb diet, walked 6 miles on an exercise. In late July, I had lost 50 pounds and I was getting regular normal blood sugar readings. That's great. I have taken my meds. I haven't taken my meds and I have still had normal readings. I have lost 80 total pounds. So that's great. Again, when I talk about the weight and diabetes relationship, there is some relationship, but it's not totally direct. So think about this. If you're losing income, if you are making less money, you will need to buy a less expensive car. You will need to live in a less expensive house. But that doesn't make you rich, right? You're just able to maintain better if you are reducing your house size, reducing your car size, etc. Which now you can continue your life without going into debt. So diabetes is just like that. So when you lose weight, your blood sugar goes to normal, but it doesn't mean that you're totally out of the loop. So you can still have it as you age, even with the same weight. So you have to constantly work on your weight to ensure that the diabetes does not come back. So most people think that they are cured when they lose weight. Even after bypass surgery, when they lose up to 50% of their body weight, studies show that after 10, 15 years, they gradually either gain the weight back or diabetes comes back sometimes later as well. So Guardian Angel said, I got back on TRT in March 2020. My A1C dropped from 7.4 to 6.5 in 7 weeks. Why isn't low T and TRT discussed by endocrinologists as possible treatment for diabetes, at least for men with low T? So good question. I get this question all the time. So low testosterone in men is very common when you have diabetes. Now, what a lot of people don't know is that if you are a totally healthy individual and you lose your testosterone from a pituitary tumor or a testicular failure, yes, you may gain weight and replacing testosterone may return your health back to normal. But if you're overweight, especially abdominal area, if you have metabolic syndrome or insulin resistance, your testosterone will naturally go down. Since metabolic syndrome and insulin resistance are considered sickness by your body, when we are sick, our testosterone levels go down. It's like when you are in a balloon, like in the air, and when you're running out of gas, you start throwing things away, right? Like you see in the movies, to make sure that you're able to maintain what you have. So when your body is sick, your testosterone level goes down because your body concentrates on other hormones for survival. So more than 50% of patients with men with diabetes have low testosterone level, but the studies show that when you give testosterone to men who have low testosterone due to diabetes or insulin resistance, they actually sometimes have more heart attacks. This has been studied. So I'm not a big fan of just giving testosterone to men who have diabetes to improve their diabetes because that has not been shown. Now, if you are really, really low in testosterone, again, depends on the reason. Let's say your testosterone is down to 100, you feel horrible, you can't even move, you get your testosterone levels up. Yes, I agree with that. But if your testosterone level is around 250, right around borderline, giving testosterone in my practice also, patients really don't feel any big difference in their exercise capacity and so forth. Their abdominal circumference doesn't get any better, and so on. So again, depends on the reason, but just giving testosterone to individual with insulin resistance, metabolic syndrome, or diabetes does not improve their diabetes. So if that was the case, believe me, we would have prescribed testosterone right and left to everybody because we want our patients to be happy and healthy. But in practice, it doesn't help. Studies doesn't show that it helps unless you had testosterone deficiency to begin with. that led to diabetes, but that's typically the other way around. So typically people develop diabetes and metabolic syndrome from inactivity, etc., abdominal obesity, then they lose testosterone. But again, testosterone loss is a secondary reason to diabetes. So as a result, you have to fix diabetes, metabolic syndrome, and abdominal circumference. And studies show that when you lose 10% of your body weight, your testosterone jumps up by 100 points. So again, the best way to do it, if you let's say your testosterone is 200, if you lose 30% of your body weight, your testosterone naturally can go up to 500. Plus, you are not going to become a testosterone dependent patient. Once you stop your testosterone, you make yourself testosterone dependent, and your body may not be able to recover easily. When you stop testosterone, your body is not going to be able to make testosterone right away. I hope that answered the question. So somebody said, how do I count carbs? That's a 3-hour topic. I don't think I can answer that here. You will need to practice that. We have a lot of videos. I have a diabetic diet video that's around 40 minutes that kind of goes over that in a systematic way for Lena Asher. I would suggest watching that video multiple times because, counting carbs is a skill that you have to learn, and you have to kind of study it a few times to get the hang of it. But how to count carbs is not necessarily a 5-minute topic, so I will not be able to help that as much here. Mind and sales coach. I'm type 2 diabetic. How many grams carb per meals? How many grams of protein? How many grams of fat should I eat per meal? I'm 36-year-old. So that depends on your your activity level, how muscular you are, how active you are, and what type of diabetes you have. So as a rule of thumb, I would suggest if you're type 2, eat as low carbohydrates as possible, unless you're addicted to carbohydrates. So some people will say that I have to have my bread, otherwise I'll die. If you feel that way, then you can have your slice of bread at breakfast, and make sure you also look at other carbohydrates. So a lot of things have carbohydrates, so you have to really look at the nutrition labels carefully. But rule of thumb, I would say if you're type 2 diabetic, 36 years of age, if you're just an average individual, I would suggest staying below 45 grams is your best bet. And then if you're eating 45 grams of carbs and your blood sugar is spiking, and again, one thing you have to be careful about is the glycemic index. So for example, if you're eating potato, that's horrible, because potato has a glycemic index so high, it's above 100. So your blood sugar will spike within 30 minutes to very high levels. But if you're having, for example, parsnip, that actually almost tastes like a potato, but the glycemic index is down to 50, that's a very different story. So when you're eating your carbs, you have to be very careful what carbs you're choosing, and you have to choose the glycemic index, low glycemic index below 55, and you have to make sure that you're not having too much of it. So 45 grams of carbohydrates with low glycemic index per meal will prevent blood sugar spikes. And if you're still having spikes, then you can consider medications or improving your exercise capacity and so on. So Susie Rudolph says, I'm on Lantus and Humalog trying to lose weight. I have read that insulin is stored as fat. Could I just stop my insulin to help my weight loss? So insulin is not stored as fat. Insulin just helps your body store the fat. So what ends up happening here, when you take insulin, it is never exactly what you need. It's hard to, you're just estimating what your needs are. Now, what ends up happening is people start taking insulin and start eating to prevent a low blood sugar from that insulin they take. And excessive use of insulin can definitely cause excessive weight gain. If you want to avoid weight gain with insulin, of course, you have to try to take less insulin. To take less insulin, you have to have less carbohydrates in your diet and more exercise so that you can become insulin sensitive. So unless you're type 1 diabetic, right, so your body makes insulin, you're just insulin resistant with type 2 diabetes, and you're not making enough insulin either. So whatever insulin you're making, in order to get the best out of it, you need to make sure that you're not eating carbs. Just like analogy is, if you're not making a lot of money, then you better not spend a lot of money, right? So that's like your carbs. If you're eating carbs, it's like spending money when you're not making any money. So number 2 is exercise. So if you're exercising, then that exercise will take the sugar, your muscles will pick up the sugars, so your sugar will not spike, As a result, you will not need as much insulin. So, and then if you are doing everything you could and your blood sugar is still spiking or going higher, some people need basal insulin. Now, the basal insulin doesn't make you gain as much weight as the mealtime insulin, but there are some other alternatives. For example, that a lot of medications out there that if you have an endocrinologist, I do that all the time. I take people off of insulin all the time just because there's so many medication alternatives out there that primary care doctors simply do not consider. Or even if they consider, insurance companies block them because they don't want to pay for the expensive medications. And then they don't have time to fight with insurance companies, so insurance companies end up winning because doctors don't have enough time or money to fight against insurance companies to get the medications. So in my practice, we do that. It costs us a lot of time and money, but we try to do our best because that's what we do. It is what it is, but again, taking less medication is better. But if you have to get rid of insulin, you may have to replace it with another medication that can help your body generate that insulin. So make sure you have an endocrinologist and discuss that topic with your endocrinologist. So your needs may be different. So. All right, so the next one is Robert. Robert says, my endo will not check my T3, T4, and reverse T3, free T4. That's a thyroid question. So we are right now doing basically diabetes talk, but I'll briefly answer that question. She said that the only reason she would check those if they had an abnormal TSH. Well, that's not 100% true, but depending on your situation. So if they are suspecting a pituitary origin, so if they think that you may have a pituitary failure, then we check T3, T4, etc. Reverse T3 is a thing of the past. It only goes up if you're sick, from like in the hospital, from an inflammatory condition, from pneumonia or something like that. Reverse T3 really has no help at all to a clinician who knows what they're doing. T3 and T4, we sometimes check it if you have hyperthyroidism, if you have severe hypothyroidism. They talk about TSH so much because TSH is thyroid stimulating hormone. So if the IRS, for example, is going to your manager and look at your records, and the manager says, this is how our records, and IRS says fine, they're satisfied, they're not going to go to the employees and try to ask text questions to employees, right? So T4 and T3 are the employees. The TSH is the manager. So if TSH is happy overall, unless they suspect that the manager is crooked or corrupt, then there should be no problem, because TSH is your ultimate manager, ultimate CEO of thyroid regulation. So that's why a lot of doctors who try to also make sure that they do not spend that money that turns to you back as a higher premiums, they try to do that so that they end up not spending too much on the blood work. But really, your T4 and T3 is not going to be abnormal if your TSH is normal. And there are a lot of crooks out there. Just be careful for this misinformation on the internet. A lot of like nurse practitioners or wellness doctors or those hormone doctors, self-claimed doctors who are maybe family doctors, but they really think that they know better without any education or training. They will say things like, oh, your T4 is on the low side, let me give you some T4, you'll feel better, and stuff like that. But these are actually malpractices. So if your doctor is doing that, you can actually sue them for that, because that's actually a harmful thing to do. So Chinton said, what is the remedy for continuous hypoglycemia? I don't know what you mean by continuous. I think he meant like recurrent. So basically, you need to find out why you're having low blood sugar, right? Hypoglycemia is a low blood sugar. If you're on insulin and you're constantly having low blood sugar, definitely you need to adjust your insulin. That's number one. There are some medications like glipizide, glimepiride, etc., or glyburide. Those medications definitely trigger a lot of low blood sugar. So if you're on medications that trigger those, definitely make sure you talk to your doctor and try to change those medications. Otherwise, you're not going to get out of it. Now, if you are not diabetic and you are having low blood sugars, then your doctor, and typically an endocrinologist, I would suggest, need to work you up to make sure that you don't have any insulinoma or any similar condition. Insulinoma is a tumor that is seen 1 in a million. It's not that common. There's something called reactive hypoglycemia that is common, and that happens when you eat, carbohydrates and you do not accompany that food with fat or protein. Then you will have low blood sugar after a blood sugar spike. That's why we call this reactive, because your blood sugar spikes first, your insulin goes up right after, and then your blood sugar plummets because your body absorbs the sugar so fast, but then your insulin stays in your system for a while. So because especially if you are eating high glycemic index foods that spike your blood sugar, or if you're insulin resistant, sometimes that insulin will overshoot and it will eventually drop your blood sugar. So if that's the case, dietary adjustment will be recommended. So Lori Spare says, I have been on a low carbohydrate diet since April 24. I lost 15 pounds and I gained 100, now I'm 125. My morning meter readings are 125 to 113. Carbs are 30 and under. I would like to get my numbers under 100. So again, you can do that if you exercise more. Again, your insulin producing capacity is determined. So if you're having blood sugar problems with 120, 130 pounds, it's really not much. So basically, it suggests that your body is not able to make enough insulin to begin with. So if that's the case, you will need to exercise more, because that's basically taking the blood sugar from your body and making you more insulin sensitive. And that's the way to go below 100. If you cannot exercise, which unless you're totally disabled, I don't know why. A lot of people will say that I have aches and pains and I cannot exercise. But I think you shouldn't have any excuse for exercise. There are a lot of ways. We have a video about exercise for diabetics, so you can look into that as well. There's other ways, even from sitting, you can do exercise. If you cannot do any of that, and if your blood sugars are not coming down below 100 after a month of changing your exercise pattern, especially with cardio, at least an hour a day, then you may need an insulin sensitizer type of medication. So Lena Asher says, is combination of rice and salad considered high carb? Well, it depends on how much carbs you're having and what you're putting in your salad. So if you're having a fruit salad and if you're having a lot of carbs and rice with it, yes, definitely it will cause, it can definitely increase your blood sugar. Again, like, you have to really measure how much carbs you're having. Even a salad can spike your blood sugar. Now, if another thing is, there's something called Chinese restaurant effect. Like, you can eat a lot of stuff that doesn't even have calories, but when you do that, your body will create certain hormones that will create insulin resistance. So overstuffing yourself with even undigestible food can sometimes increase your blood sugar. So you have to be careful about that as well. Robert Simpson says, is it a good idea to get a fasting insulin blood test? Well, that depends on you. Again, your endocrinologist will do that, especially C-peptide is a better test than a fasting insulin. But if you're an insulin resistant patient that I'm trying to find out, what your insulin levels are with a fasting blood sugar, like a normal blood sugar. So if your fasting normal blood sugars are normal or below 100 at least, and then your insulin levels are really high, that's a problem that just tells us that your body is making too much insulin to do a very little job. So that suggests insulin resistance. We sometimes check C-peptide to see if your body is even making insulin. So for type 1 or type 2 diabetics or newly diagnosed patients, sometimes we do that. But unless you're losing weight unintentionally, that means that your body is making insulin. Because really there's no other way you will lose weight. So sometimes checking insulin levels makes no sense if somebody is telling you that they are easily gaining weight, because you cannot really gain weight without insulin in your system. So these are clinical clues we always look in our patients. Just ordering a battery of tests, ordering $1 million test doesn't really make you a good doctor. A good doctor is the one that actually knows what he's ordering and knows what to do with the result. So a lot of times patients will come to me and they have all this testing, they're panicked because everything looks abnormal. But then when I'm like, what did your doctor say about this? They're like, no, nothing. They just said everything is abnormal. So that's actually not a good way of being a doctor. So you have to make sure that your doctor is ordering the test for a reason, for a specific purpose to diagnose something, and they should know what to do with the result. Peter Lazarov says, how to treat a normal glucose high insulin, which is insulin resistant patient with a 5 millimeter pituitary prolactinoma, which has been inactive. So it's interesting that some prolactinomas tend to create insulin resistance. That's a known thing. We don't know how, but when the prolactin levels are high, sometimes they can trigger insulin resistance. But I mean, of course, treating a prolactinoma, a prolactin tumor, is a different situation than treating diabetes. But no matter what the reason is, insulin resistance is insulin resistance. So there are things that increases your insulin resistance, and there are things that reduces your insulin resistance, right? So now you have to concentrate on what can reduce your insulin resistance. Number one is the abdominal circumference. If you are abdominally obese, you have to make sure that you do a lot of cardio, a lot of exercise, aerobic exercise, in order to reduce that insulin resistance. So even if you do that for a week or two and you reduce your carbohydrates in your diet, or at least eat healthy carbohydrates with low glycemic index, you will definitely see your insulin levels go down. Now, you will know that your insulin levels are going down. You don't have to repeat the test. If you're losing weight, I can assure you that your insulin levels are going down, because insulin levels are directly related to your body weight in insulin resistance and abdominal circumference. So you can know that by just weighing yourself every day, continuing your exercise, staying active and dedicated, then you'll be okay. So here's another question. Baby Asmir, does water tablet affect your kidney? I guess Baby is talking about the diuretics, the water pills, some people call them. Do they affect your kidney? Well, it depends on why you're taking it for. If you're becoming dehydrated from it because you're urinating a lot and you are not replacing that water, that can affect your kidney. So some people take those water pills to in order to get rid of the swelling in their legs and stuff, and they don't have any blood pressure problem and so forth. That can be a problem. But sometimes people with high blood pressure take those water pills, and that reduces their blood pressure. That actually helps the kidney, unless they become really dehydrated, which should not be the case. So if you're taking this just to get rid of the water in your body or lose weight or something like that, that can definitely dehydrate you and cause kidney problems. But if you're taking it for blood pressure and you're not becoming dehydrated, then you should be okay. Somebody asked MCPA99. I was prescribed Cymbalta for neuropathy, but it gave me headaches. Is it a medication that you would recommend? Of course, any medication can give side effects, right? So if Cymbalta was prescribed, the question is, did it interact with other medications? So let's say you're on a medication that can interact with Cymbalta, that actually pushes the Cymbalta levels very high, that there's more chance of having a side effect from it. Also, you have to start slow. If you're sensitive to a medication, you can start as 15 milligram of Cymbalta instead of starting 30 or 60 milligrams. So sometimes, if you complain too much, your doctor may give you a big dose, and that may be a problem. But if you start a medication like a low dose and gradually increase your dose, the tolerating that medication is going to be a lot easier than starting a high dose. And it's not uncommon for this type of side effects to go away. So if medication is helping your neuropathy, for example, start with the low dose, gradually go up. If you have headaches, unless they're excruciating, sometimes the headaches even will disappear. As long as you're getting relief from neuropathy, I would suggest to stick to the medication for a while, or reduce the dose and try again. So giving up on medications very easily is not always the best idea. Now, there are other neuropathy medications definitely you can try, but I would suggest that make sure that you're taking Cymbalta very correctly before you just dump that medication, okay? So Robert Linek, to clarify, the rise is steady and doesn't happen every night. So that was, I don't know what question was that about, but I think I answered that question already. So, okay, so he said he was prescribed 60. That's a pretty high, hefty dose of Cymbalta. You can, if it is not a capsule, if it comes in a tablet, you can break that into half and see how that does for you. Even you can do 15 milligram if they can prescribe that to you, or divide the pills into even more. You can divide the 30 milligram into 2 as well. So Peter says, what exercise would you recommend for a patient with type 2 obese patient who has 2 hernias on L3, L4, and L5? Is swimming and walking enough with a good diet? Yes, if you're swimming, actually, that's probably your best bet. Walking, if it is not causing problems in your lumbar spine, you can do that. If your lumbar spine is very sensitive to moving around, bending over, or walking, then one thing you can do is basically just sit down and do sitting exercises. You can do bicycling, where you can just lean your back. So most problems with lumbar spine issues happen if you are bending over, like trying to lift weights, or if you are, let's say, on a treadmill, on an incline or something like that, can definitely give more back problems. But if you are stabilizing your back and trying to do bicycling or some other exercise, sitting exercise, which you can find in our video as well, in one of our videos has also the different exercises for diabetics who are not very mobile. You should be okay. But swimming, if you have the ability, if you have a pool yourself, or if you have a community pool, you can go. That's probably your best bet, because the swimming basically takes the weight off of your joints. So that's a good way to do it. And depends on how much, if you're swimming 15 minutes, that may not be enough, but I would spend enough time and do laps back and forth to make sure that you're spending a good amount of energy. Okay, so the next one is the patient, the metformin has good glucose, but needs to lose weight with those medications. So yeah, I mean, there are a lot of diabetic medications that can help you lose weight. GLP-1 class or SGLT2 class are good ones. The GLP-1 class has Ozempic, Rybelsus, Victoza, Trulicity, Bydureon, and so forth. The SGLT2 class has Jardiance, they have Farxiga, they have Invokana and Steglatro. So these are the agents, and of course, which one is the right one, that's between you and your doctor. But those agents definitely help on top of metformin to not only control your diabetes, but also help you lose weight. Muhsin Haidar said, do you recommend to use ACV every day for type 2, 2 spoons first thing in the morning to help control type 2? Is that a good idea? I don't know what exactly ACV stands for. Maybe you can clarify that there. Maybe apple cider vinegar. Okay, probably that's what he's talking about. So apple cider vinegar, 1 to 2 spoons is okay. I would use it in my salad. I mean, I don't think it's very tasteful to try to do that like without any other thing that goes with it. But apple cider vinegar in your salads is definitely a great way to help your diabetes. Now, I have been working on, you guys have been asking about a diabetes supplement that can help your blood sugars. I'm working hard on this. I am going to come up with a formula that will help you guys tremendously. I have used a lot of diabetes supplements for patients who are willing to use those supplements, or people who are asking for supplements, and I've had their feedback a lot. I see hundreds of patients, if not thousands, on the supplements. So I have a good idea of which one works and which one doesn't. So I'm coming up with my own formulation. It's in the production stage right now, and I'll ask your opinion on that. Once it's on the market, I'm going to give you guys a very good discount that you cannot find anywhere else. And I'm hoping that a lot of you will benefit from it, because in this day and age, the medications are so expensive. They have a lot of side effects, and we will hopefully overcome that problem. So Robert says, I have type 1 diabetes and my sugar goes up steadily overnight, on some nights to 200 or higher by the time I wake up. What is the best way to deal with this if you're on MDI, which is multiple daily injections? So, well, I would suggest, Robert, the best thing you can do if you're not on a continuous glucose monitoring system, you can check your blood sugar at bedtime, check it at 3 o'clock in the morning, check it at again when you wake up. Trying to find out if you have dawn phenomenon or a 𝐒𝐔𝐆𝐀 effect. So if your blood sugar is actually bottoming out at 3 o'clock in the morning, you may be rebounding. That's 𝐒𝐔𝐆𝐀 effect or 𝐒𝐶𝐆𝐲 effect. But if your blood sugar starts going up starting at 4 or 5 o'clock, let's say your blood sugar is okay at 3 o'clock, let's say 130, but you wake up with a 200 blood sugar in the morning, then that's a dawn phenomenon. That is, if that's the case, it's harder to deal with, because if you increase your basal insulin, that can put you into a risk for a low blood sugar at 3 o'clock. So when you're trying to correct your 200 blood sugar in the morning, if your blood sugar is really good at 3 o'clock, but if you're having steady increase, let's say you go to bed with 150 or 140 and you wake up with 200, and then your blood sugar at 3 o'clock is not low, then you can definitely increase your basal insulin, provided that you consult with your doctor, whoever is treating you for that. If they're not willing to help you, definitely get a second opinion, get an endocrinologist opinion, because it's not really that difficult. What I recommend is, if your morning numbers are higher than the bedtime numbers, that's true for type 1 and type 2, and if your 3 o'clock morning sugars are not low, then you can basically increase your basal insulin 1 to 2 units every day until you get this morning blood sugar under control. When you do that, just 1 unit a day is a very safe way of getting your morning numbers down, especially if you're dealing with these overnight high blood sugars. For type 2 diabetics, we sometimes give them insulin sensitizers that can help them without having to take insulin. But in your case, as a type 1 diabetic, I would see what profile you have overnight, and then try to gradually increase your basal insulin to try to get your morning numbers under control. And again, this is true if your numbers are going up overnight. If your numbers are already coming down overnight and you're still high in the morning, you have to concentrate on your bedtime numbers to control those bedtime numbers. So let's see. The next question is about neuropathy. Somebody is taking Previsca plus Dozella 30 milligram for neuropathy, but no relief in pain in legs and hands. I would definitely, if your blood sugars are running high, your neuropathy control is not going to be easy. So sometimes patients just think that they can just take a medication, neuropathy will go away, and they're still running in the 200 blood sugar level. That's really not going to help you, because every time you have a high blood sugar, or even fluctuations, significant fluctuations in your blood sugar, will trigger neuropathy, and medications may not be so effective. So the best treatment for controlling your neuropathy is controlling your blood sugar numbers. And if that's not helping, continue trying different medications. In my experience, Lyrica has the best effect, not without side effects, but if neuropathy is so horrible, then you have to do something. You can also ask your doctor to prescribe you a compounding medication, where you can use as a cream just when it really hurts, especially at nighttime. Diabetic neuropathy can be really bad and can take away your sleep. If that's what you're experiencing, I would suggest definitely using even topical things to help with the neuropathy. So somebody is from Thailand is asking, can I use another fruit vinegar, such as banana vinegar? I guess you can. I don't have a lot of experience with that, so I'm not going to be able to answer you very clearly. I'm sorry about that. So Vidya says, my fasting blood sugar has been consistently around 100 to 110. What treatment is good for me? Well, that depends on Vidya, like what stage are you in your diabetes. So if you are a new diabetic, your blood sugar is 100 to 110, that's actually not bad at all. Because if your numbers are not spiking, start concentrating on your after meal numbers. So because a lot of people will have okay fasting numbers, like they will wake up with 100 and 110, but then during the day, they may be going up to 180, 190, 200, especially after meals. So check your blood sugars 1 to 2 hours after meals. And if you are staying below 150, 160 after eating, that's really not a bad number. So you don't have to be too concerned about that. Of course, provided that you have to keep up with it so they don't, keep monitoring so they don't go up. And then anything and everything you can do to help your diabetes will definitely help, like diet and exercise if you're type 2 diabetic. But if you're really ranging 100 to 110, a lot of people will be very happy to see those numbers. So I wouldn't be too concerned about those numbers at that point. So we are 40 minutes into our chat. So we have a couple more minutes to go. If you have other questions, please send it in, and we will try to answer the best we can. Okay, let's see. Again, so one thing I want you to realize, guys, diabetes is not necessarily a curse, okay? So you can definitely live with diabetes. You can definitely have no problems, no complications whatsoever. You have to have a good balance. You don't want to be super OCD about your numbers, and you don't want to be super lax about your numbers either. You can still have your life, do what is necessary. It's just like, if you have bills you have to pay, you gotta do what you gotta do. You work hard, you get things done. If you have diabetes, don't let that take you down. Have a positive outlook in your health. If you think that things will be good for you, that you can beat diabetes, and diabetes will not affect you in any way. Believe me, you are going to be way more motivated to do things that will help you. So your brain will generate that energy. But if you have constantly negative thoughts about your diabetes, about yourself, about keep blaming yourself, that's really not going to make things any better for you, and you're going to end up having more problems and probably end up having worse diabetes and even complications. So there are more questions coming in here. So what if you are on medications but you're still hitting 200 on your fasting blood sugars? Well, definitely that means that you're not on the right medications. That's number one. So a lot of times people come to me like very hopeless. They think that they have done everything and their blood sugar is not going anywhere, but they actually just don't know what they didn't do. So there's so many things that can be done for patients with diabetes, depending on what they're willing to do. I tell them, hey, are you willing to, go into an exercise and diet program? Are you willing to consider different medications? So I think that's not that hard to bring your fasting blood sugars down. Again, diabetes is a disease where everybody has a difference in their management. So like 10 people walk into my office with a new diabetes consultation, and 9 out of 10, one person gets a different medication than the other. So it is very unusual for me to prescribe the same medication for 2 consults back to back, because I definitely understand their situation, what their life situation is, what is going on with their life, what is their financial situation, what is their social situation, what is their family situation, how long they have been diabetic, what they have tried in the past, what can we do together. So I think your best bet is to work with your endocrinologist closely. And again, I don't want to give blanket answers to you, but as I said, if you, and I don't know even which country you're in, which medications are available, but nowadays in this day and age, not having an uncontrolled diabetes is a shame. So unless patients are totally non-compliant and they just do whatever they want, they don't want to take their medications, they don't want to go on a program with a diet and exercise, then you cannot help those people. But I mean, if like you guys are interested in helping yourselves, and I'm sure you'll find ways as long as you are in close contact with your doctor. And don't hesitate. I mean, if your blood sugars are running high, pick up the phone and just talk to your doctor. If you need a visit to discuss your medications, do it. Do whatever is necessary. So if you really think that you need to bring that number down, you will bring it down. You will find a way by talking to your doctor, by changing your lifestyle, but I wouldn't necessarily try to go crazy and try everything that you see on the internet. But I would definitely discuss with your doctor, if necessary, get a consultation with an endocrinologist. So your options to bring your morning numbers down, it could be insulin sensitizer pills. It could be medications that can actually help with the morning numbers, like insulin, basal insulin, which is I'm not a big fan of. You can use GLP-1 agents. You can use SGLT2 agents. They will all help you bring your numbers down. Okay, so the next one is my blood sugar is lower when I go to bed. When I wake up in the morning, it is around 110 or higher. What's the best thing to do without prescription medications? So again, the best thing to do, depending on your activity level, if you are increasing your exercise, that will definitely bring your blood sugars down. That can take a couple days or weeks, but you need to be consistent with your exercise and your blood sugars will go down if you're type 2 diabetic and insulin resistant. If you're type 1 diabetic, that's a different story. Then you have to adjust your insulin regimen depending on what you're taking. It could be insulin pump, it could be something else. It could be a basal insulin, but that needs to be adjusted. So definitely what happens overnight is your body is insulin resistant and your liver is making sugar. You just have to make yourself more insulin sensitive, or you have to take a medication to overcome that insulin resistance, basically. That's a quick answer. Aside from diabetes, I also have genetic hypertrophic cardiomyopathy, and my cardiologist discourages me from strenuous exercise. So you don't have to do strenuous exercise. What you can do, you can have a milder exercise, but a longer duration. So again, you don't want to get your heart rate up to 150, 160. You can go up to maybe 110, 120, whatever your cardiologist allows. Monitor your heart rate and then try to do longer exercise. So instead of running, you can do walking. But instead of like running 2 miles, you can walk 4 miles. And that can be the way to go for you. So as long as exercise is totally prohibited and you're like you're given bed rest, you should be okay. And if you're in bed rest, then all you can do is basically medications, unfortunately, at this point. So my fasting blood sugar sometimes is 165. That's Maria. I don't think medicine. I don't drink medicine, but I do intermittent fasting. Is good. Yes, whatever you do, intermittent fasting, exercise. Again, it's a goal. So if you are doing something that's not necessarily helping you enough, that doesn't mean that it's not working. That means that you have to do even more, or maybe you need to do something else. So for example, if you're doing intermittent fasting twice a week, and if it's not helping you enough, you can maybe try to do 4 times a week, 5 times a week. You can try to increase your exercise to bring your blood sugars down if you're not wanting to take medication. But again, you do everything right. You exercise every day for an hour. You do intermittent fasting 3-4 times a week. Your morning numbers are still running high. Then you may need a medication, because sometimes, as I said, type 2 diabetics also do not live in a full insulin capacity. They actually make less than what they can live with. So sometimes insulin sensitizers or insulin may be necessary. Okay, so Lucas says, hello, I was diagnosed with type 1 since June. I am in the honeymoon period. How long does it last? What will happen at the end of it? Is it sudden? So I have seen a lot of honeymoon periods, and it's interesting that it can last 6 months and it can last years. There are some studies, Lucas, that says actually if you take insulin, since you're type 1 diabetic anyways, even during this honeymoon period, very little, you're not going to need much. Very little insulin, like a basal insulin, can actually help protect your beta cells. It's basically like giving a little break. So let's say you have 10 employees and then you're down to 2 or 3 employees. And if you ask the 2 to 3 employees to do the same job that your 10 employees used to do, what will happen? They're going to burn out and they're going to leave you, correct? So beta cells are the same way. So beta cells are, by the time, even if you're in a honeymoon period, you are having anywhere from 10 to 20% maximum beta cells alive that's left behind. So if you work those guys hard, and if you don't diet well, eat a lot of carbs and make them work hard, that's going to be a problem. But if you give a little bit of an insulin, like if you borrow some other employees from another company for a while until so to keep those good employees that you have, then that's going to help you to go on a full-blown insulin where you have to take 4 shots a day. Sometimes taking that 1 shot a day, it may be 5 units or less, depending on your overall body size, but it could be anywhere from 5 units to 15 units for most type 1 diabetics. But if you do that, you may actually benefit from it in the long run, and you can prolong your honeymoon period. Again, this is not a foolproof evidence, but there are studies supporting that hypothesis quite a bit. There are also, if you go to clinicaltrial.org, they have type 1 studies that are going on. If you want to be part of those studies, so you're more than welcome to be part of those studies, and possibly it may help you as well. But the question is it sudden? Do you come off of honeymoon period? Again, that depends on what you're doing with your life, depends on what you're on, and so forth. But most of the time, as long as you monitor it, it's not going to be sudden. What happens to people is they get comfortable and they say, oh, my blood sugar has been fine, I'm in the honeymoon, and they get comfortable. And then the next thing is they know that their blood sugar is 300. But if you see your blood sugars are creeping up on you, you may make some adjustments in your medication or in your diet that may help you maintain those beta cells a little bit longer. Peter says, is it okay to give 1,000 milligram of metformin to a patient with type 2 diabetes who has type 2 mechanical valves, 4 bypasses, and some arrhythmia? Unless you have heart failure, so unless you have a decompensated heart failure, metformin is not contraindicated. So having a bypass or having other problems. Now, unless your creatinine is very high, again, if you don't have a decompensated heart failure, if you do not have a liver failure that is decompensated, if you do not have advanced kidney disease, it's okay. Now, the metformin, we reduce it down to 1,000 milligram or less if your GFR is below 60. But you can go on a low metformin, especially if it is very helpful, because sometimes people stop metformin and they end up going on insulin. Now, if that's the case for you, you may want to stay on a low dose metformin as long as you do not have a decompensated heart failure. Again, 1,000 milligram twice a day for a relatively good heart with a good ejection fraction. I wouldn't be too worried, because I think that's going to help you. Now, what happens is if you go on insulin instead of metformin, that can actually do more harm to your heart, because insulin will allow you to retain water, and your heart is supposed to deal with that excessive fluids. So as a result, I actually don't like insulin in a patient with active heart failure. So Vidya says, another thing you have to be careful about when you have heart failure actually is pioglitazone more than the metformin. Just be careful with pioglitazone, especially when you combine pioglitazone, which is octose, with another insulin, you're increasing your risk of heart failure or decompensated heart failure, even if you are compensated right now. So what is the best treatment for hypoglycemia at home? So low blood sugar. So if you have a low blood sugar, there's 15 rules. So what you do is you eat 15 or drink 15 grams of carbohydrates. That could be half a glass of juice, or it could be 4 or 5 crackers, or it could be 4 glucose tablets. Nothing with fat, no Nutella, no peanut butter, nothing like that. So you can have a hard candy, but not a candy bar. Like Snickers is not a good way of fixing blood sugar, right? So you have to have either a juice. So normally that you would think that it will spike your blood sugar, that's what you should be having. Bread is okay as well, but you don't have too much, because what happens is you get panic when your blood sugar goes low. It's not a good feeling. So people start eating the entire kitchen, and they end up with the blood sugar of 400, 500. Now, to avoid that, this 15 rule is you are eating 15 grams of carbs, and even if you still feel like you want to eat, just give like 10 to 15 minutes and recheck your finger stick. And then after you check the finger stick, if your blood sugar is now in a good range, That's good. Unless you have taken insulin, unless you have taken a medication that you think that can drop your blood sugar, you may want to, you don't have to recheck, but you can in half an hour again to make sure it's not drifting back down. Or if you're having a meal after that with a regular meal that you normally do have, you can do that as well. That can maintain your blood sugar. Or you can have something like more like a peanut butter with bread that can maintain your blood sugar in a little bit longer run. But for the short run, for 15 minutes, you are eating 15 grams of carbs, rechecking it, make sure it's okay, and then take it easy from there. So that's the way to do it. Now, of course, if you can be unconscious at home as well, having a glucagon pen, especially on patients on multiple injections of insulin or type 1 diabetics, should always have a glucagon emergency pen where you just inject to the muscle, and then your blood sugar should rise, 10 to 20 points at least immediately after the injection. It can save your life or a disability while waiting for the emergency services to arrive, especially for older people. That's important. Younger people are not as much affected. I mean, I created low blood sugar on myself. It didn't feel good, but I didn't feel like I was dying either. So, but the older you are, the more affected you're going to be. So Lucas says, I'm actually taking 7 units of Lantus and 7 units of Nova. Again, let me go back to the question. The honeymoon period, yeah, I mean, if you're in honeymoon period and you're doing this and you're not having low blood sugars, that should be okay. But I'm not sure if you are concerned in the honeymoon, because normally if you're a skinny person, if you take 7 units of Novolog, you will probably bottom out if your body was making a lot of insulin. If you were really in honeymoon period, that sounds like a little bit high insulin dose for somebody with type 1 diabetes and a very low insulin resistance. We have 3 minutes left for the live show here. David says, what are your thoughts about metformin and how it affects the liver? I have a liver disease and my doctor is reluctant to put me on metformin. So liver disease is a very generic term, right? So a lot of people with insulin resistance, for example, have elevated AST, ALT, like the liver enzymes. Would you call that a liver disease? Yes, like a fatty liver disease from insulin resistance happens a lot. And actually, metformin helps for that type of liver disease. Now, if you have a hepatitis, for example, or cirrhosis that is not under control, your albumin levels are low, your bilirubin levels are high, meaning that your liver is basically actively sick. We call this a decompensated liver failure. In that case, yes, we do not start metformin. But a lot of doctors, they're also affected from the media, or they're also affected from the public opinion, and they're scared to do those things that can actually help patients. And the idea that the metformin shouldn't be used for any patient with kidney, liver, or heart problems, actually you are kind of losing some opportunity there just from out of fear. But if you know your patient, and your patient does not have an active liver failure, it's just a little bit of a liver enzyme elevation, that's definitely not a reason to stop metformin. I mean, you can stop it. It's not like metformin is the best drug ever, but then you will have to probably do something else. So then the question is, what do you want to really do? So, and herbal medications also can help with that, but then the herbal medications should be really, if you have a liver disease or something like that, you can have your doctor monitor you for that as well, because not every herbal medicine is going to be safe for you either. So you have to also be careful with that. So that's why when I'm creating this new herbal medicine combo, like a formula, where I believe that it's not going to hurt the liver, it's not going to hurt the kidneys. There are a lot of studies, and then a lot of my patients have been on these medications, and hopefully within a few months we will come up with the medication where if you guys don't want to be on metformin, don't want to be on this, don't want to be on that, or medication is expensive and so forth, it's going to be a game changer. Hopefully, that's my hope. Do you see new patients from out of state? So we see patients in Florida and we see patients in New York. All our patients are virtual visits, and we do everything we can do in person virtually, just like this. We can download your meters, pumps, continuous glucose monitoring systems, whatever you name it. We can access your data. We also have the app that actually connects you to us, the SugarMD's app. Definitely helps you guys. If you're our patient, we can definitely use that app to communicate and get your data. But out of state, other than Florida and New York, right now we don't. In Florida, we accept certain insurances. In New York, we do not accept insurances. For out-of-state patients that are like in Texas, we get a lot of inquiries from Texas, California, and so forth. For those patients, we have a coach program where the coach will talk to you about what's going on with your life, will help you mostly with your diet and exercise. We can also recommend certain medications, but we cannot really prescribe it for you. The coaches cannot prescribe it for you, but they can have you run it by your doctor and see if they're agreeable to consider that medication that can give a second opinion in your diabetes regimen. So that's the formula we have right now for patients who are not from Florida or New York. We involve them in our coach plan. They're under my supervision. They discuss the cases with me. Again, in the United States, the law says no matter what kind of doctor you are, you have to pay your dues. You have to be licensed. It's an extensive and expensive process for doctors to be credentialed in every state, unless they have hundreds of patients in every state, which is a difficult task. So for now, that's why we are sticking with our coach plan outside of Florida and New York. Okay, the last question, we are actually out of time. How to adjust insulin for a 77-year-old patient taking 3 times daily sliding scale. So I'm gonna actually make a video, Mr. Rao, since you asked this question. A lot of people do not use the sliding scale correctly. This is a very, very, very common problem. A lot of people will be prescribed a sliding scale, but then most of the time it's either too much or too little to take care of their needs. Sliding scale has a lot of different meanings. So I will probably make a video about this for you guys who are on insulin, so you can actually understand how to utilize those sliding scales correctly and effectively. Again, thank you very much, guys. So please share this video and our other videos. Again, we are trying to grow the channel. So we are around 25,000 subscribers. Our goal to reach to 100,000 subscribers. As you all know, we are providing free information, free education for everyone. We are pretty much the only diabetes channel on YouTube that gives reliable, consistent information. So please spread the word. Liking the videos helps. Sharing the videos helps. Putting comments, even saying thank you helps. So we'll appreciate all that. And remember, our videos are consistently on a Friday and Sunday. And from now on, I will try also putting videos on Wednesdays as well, and to see how that is taken by the audience, because I don't want you to miss videos either. So, thank you for your support. We appreciate all of you, and we will see you in the next live session. And I'll try to make regular live sessions, and I will publish that a week or two before we do the live sessions. Thank you very much for everyone. Have a wonderful Sunday.